I would like to welcome you to the Joint School presentation for Alice Peck Day Memorial Hospital. Thank you for choosing Alice Peck Day Memorial Hospital for your healthcare needs. Our surgical team appreciates you taking the time to view our total joint replacement presentation. The following presentation is going to be given by content experts that are working with patients like you every day. I hope that you enjoy the presentation and come out feeling more comfortable and prepared for your upcoming surgery. Please note that based on the time that you are viewing this Joint School video, some of the content may no longer be valid or apply. Healthcare is a moving target and best practice evolves daily. Therefore, some of this information may be outdated and no longer apply. The following slides are up to date but may differ from the video. Our orthopedic surgeons have all of our patients view this presentation. We encourage you and your support person and family members to watch the presentation. This is done to help prepare our patients and their support person for surgery and the postoperative recovery period. We want you to be prepared mentally, physically, functionally, and emotionally, as all of these play a key role in your recovery. The surgeons require our patients to attend this class because we want to improve your outcomes and your satisfaction. We want you to be as prepared as possible so that nothing comes your way that you were not expecting. We want to make this process as easy and enjoyable as we can. Please know that the hardest work starts after surgery is complete. You as the patient are in complete control of how well you do and how quickly you recover after surgery. Also in how much use and function you will regain in your hip or your knee. How well you do after surgery is up to you. Please note that anything on the following slide may cause your surgery to be delayed, postponed, or canceled if they are not taken care of in time prior to surgery. We ask that you please call the clinic if you develop any of the following symptoms within 10 days prior to your surgery. Things such as a cough, diarrhea, shortness of breath, fever or chills, nasal congestion or a runny nose, sore throat, body aches or fatigue, a headache, new loss of taste or smell, nausea or vomiting, a fever of 100.5 or greater, a cold or flu with a productive cough, any cuts, rashes, openings, or issues with your skin integrity, or any urinary burning or frequency. Please know that smoking can increase your risk of infection and delay wound healing after surgery. Our surgeons and some insurance companies require that you quit smoking 2 to 4 weeks prior to surgery and refrain from smoking for 4 weeks after surgery. This will all help with your healing process. You may be required to have what is known as a urine cotinine lab test 2 weeks after you quit smoking to prove that you actually are not smoking. If your surgeon suspects that you are still smoking on the day of surgery, you may be required to have a lab test on the day of surgery as well, and if that comes back positive, your surgery could be canceled. If you need help with any smoking cessation, please talk to your primary care provider for support, and know that eliminating smoking prior to surgery will only help you with your surgical outcome. Our orthopedic team uses simple interventions to help prevent surgical complications. We're going to talk about things that we do to help minimize risk of infection, prevent you from getting a blood clot, and preventing respiratory complications after surgery. Please know that we use a team approach to make sure that no information is missed and to make sure that you feel like you are part of that team. We want to make sure that you are actively involved in your care and with the decisions that are being made about the things that are taking place. Please know that a prescription from Upiricin will be sent to your pharmacy prior to surgery. This is a nasal antibiotic that you will use twice a day for 5 days prior to surgery to help reduce the risk of spreading or catching what is known as MRSA, MRSA, methicillin-resistant Staph aureus. This is something you do not want to hear your surgical team talking about for you after your surgery. We do everything that we can to help prevent this and prevent you from having any surgical site complication. Please know that you will be given Hibiclens, chlorhexidine gluconate, which is an antibacterial solution at your pre-op consent signing visit. Those of you who are signing your consent the morning of may purchase this over the counter at your local pharmacy. This is to be used as a body wash from the neck down, and you are to avoid using it in your hair, on your face, or around your genitals, as it can be irritating. Please know that this is used to help reduce the number of bacteria that you're going to bring into the operating room with you and will help to keep you clean. This reduces any risk of infection. Please make sure that you use this HibaCleanse scrub twice before your surgery. Once the night before surgery, and once again the morning of surgery before you come to the hospital. Our surgeons ask that you do not shave the surgical side of your body for at least 5 days prior to surgery. This is because we do not want you to create any cut, nicks, or openings that could introduce bacteria into your body, because this would cause us to have to cancel your surgery. Therefore, it's better safe than sorry to not shave, and we will make sure we cut away any excess hair or clip it away the morning of surgery as we are preparing you. Please remove all nail polish and all jewelry prior to coming to the hospital. After showering on the night before surgery, we ask that you do not apply any deodorants, body lotions, or body oils, as we do not want anything on your skin that could possibly conduct electricity to places that we do not intend for it to go. After you shower using the HibaCleanse scrub the night before surgery, please use clean laundered towels. Please put on clean clothes, and please make sure that you change your bed and are getting into a nice clean bed. Something that you need to be aware of if you're going to be having orthopedic total joint replacement surgery is that you are not to have any dental work, including cleanings, for 1 month prior to your surgery, and then you are not to have anything for 6 months after your surgery. Please know that you will need to take dental antibiotics if there is a dental emergency that occurs within the first 6 months of surgery and you have to have dental work done. After you are past the 6 months after your surgery, you still may need an antibiotic if you are a diabetic or someone who is immunocompromised or have had a previous joint infection. Please call your orthopedic nurse in the office to verify whether you qualify for needing an antibiotic for the lifetime of your joint replacement. If so, the nurse will send an electronic prescription for the antibiotic to your pharmacy. Please also note that you should let all healthcare providers know that are part of your healthcare team, whether that's cardiology, your primary care physician, anyone involved in taking care of you, that you are having a total joint replacement. Just to reiterate, our surgeons want to make sure that you know that you need to avoid everything but emergency dental work for 6 months after your total joint replacement surgery. Again, antibiotics are not required for immunocompetent patients, meaning if you have a normal immune system, for cleanings and simple fillings. That means nothing that involves the gums. However, pre-procedure antibiotics may be required for all patients undergoing more complex procedures such as root canals, extractions, crowns, or implants for the lifetime of your joint replacement. You do not need to make the decision whether or not you qualify to need antibiotics, so please call our office and we will help make that decision for you. Please be sure to contact our office if you are scheduled to have a colonoscopy or endoscopy procedure within the first 6 months after your total joint replacement surgery. Depending on your orthopedic surgeon, you may or may not require antibiotics prior to this procedure based on the timing of the procedure. Please call the office to discuss this if you are scheduled to have a colonoscopy or endoscopy after your total joint replacement, and we will help to navigate this for you. We're telling you a lot of things that are no's, and we're going to continue down that path. Per our orthopedic surgeons, we recommend that you do not receive any vaccines such as the COVID vaccine, flu vaccine, shingles vaccine, or tetanus shot, and so on, for 2 weeks prior to your surgery. It is recommended that any vaccinations that you need must be received 2 weeks or more before having a total joint replacement surgery. After the surgery is completed, you are allowed to have any vaccinations that you need, and there is no time to wait. Decreasing risk of blood clots after surgery is something that we like to prioritize. A blood clot, also known as a DVT or deep vein thrombosis, that can develop into a PE or pulmonary embolism, are things that we like to prevent. A blood clot can develop in your veins of your legs and can travel to other areas of the body such as your heart and lungs, causing serious complications. After surgery, you are going to be less active for several days or weeks as you are recovering. This can cause blood flow to slow down, which can increase the risk of a blood clot. Therefore, during surgery, when you are not moving, we are going to put on what are called Venadynes. These are going to be put on your lower extremities and are used during surgery and in the immediate postoperative period. They're sleeves applied to your lower legs that inflate and deflate by a machine that help promote blood flow. The best thing you can do to prevent a blood clot immediately after surgery and continuing throughout your recovery period is early ambulation. Get up and move as soon as possible. Walk, walk, walk. It's truly the best thing you can do for your recovery. We also prescribe medications to help reduce your risk of blood clots after surgery. Some patients are prescribed a medication known as an anticoagulant and take that every day. Other patients have never taken an anticoagulant, but after your total joint surgery, you will be taking it for at least 30 days to help prevent the risk of blood clot. Which medication you are prescribed is going to be based on your risk factors, which your nurse of your surgeon will help to determine for you. Examples of those medications that you may be prescribed after surgery for 30 days are Eliquis or baby aspirin. If you are prescribed Eliquis and your insurance company is going to charge you more than $75, please call our office and let us know, as we can send a prescription to DH Centera Pharmacy in Lebanon and you will be able to get this medication for $75 out of pocket. If you are prescribed to be on a baby aspirin based on your risk factors, baby aspirin is over the counter and can be picked up at your local pharmacy. If you are currently prescribed Eliquis, Xarelto, or Coumadin, you will be instructed as far as when to stop the medication prior to surgery and also when to continue it after surgery and at what doses. The next step is preventing respiratory complications. We want to prevent you from getting sick, developing pneumonia, or a post-op atelectasis. We're going to do this by having you use something known as an incentive spirometer, also known as an IS. This is used to help keep the lungs clear after surgery, as it is important to do so to prevent pneumonia. Most patients will only need to use this in the hospital, but some patients may be recommended to continue the use of this at home. Please note, this will be dependent patient to patient. Patients with a history of sleep apnea or asthma are asked to please bring your CPAP or BiPAP machines to the hospital with you for use when you are an inpatient and after surgery in recovery while you're in PACU. Also, please bring your inhalers if you have asthma so that you have them with you to be able to use in case there are any complications. Please know that a week before surgery, you are going to have what is known as a PAT, a pre-admission testing phone call. You'll receive a letter in the mail with a date and time and a telephone number for your PAT call. The PAT nurse will call you at the specified date and time that is in your letter. The information that you should have ready for this phone call is any medical or surgical history, current medications, and any questions that you may have for the surgical department or anesthesiologist. During this phone call, you will receive instructions about what medications to take or not take the morning of surgery. Prior to this, please contact the prescriber of your medications so you know what and when to stop before surgery and when to restart them after surgery. It is very important that the people who prescribe you your medications specifically help to give instructions. We ask that you do not bring any of your own medications to the hospital unless you are instructed to do so, because all of your medications should be given to you from our pharmacy while you are here with us. If the PAT nurse has, however, asked you to bring any of your own medications because we do not carry them, please make sure that they are in their original bottle, and you will give any home medications to your medical surgical nurse once you reach your room for safekeeping. In the world of diabetic and weight loss medications, there are restrictions around when these medications need to be stopped specifically prior to your surgery. If you are on any of the following medications included on the slide below, for example, Trulicity or Ozempic, and take them as an injection either daily or once a week, we ask that you stop these medications if they are weekly, 1 week prior to your surgery, and if you take them daily, you stop them 1 day prior to your surgery. If you have questions regarding these medications and when you need to stop them, please call our office so that we can specify for you and or help you contact your prescribing provider. If you are on the other type of weight loss medications, the SGLT2 inhibitor medications, which are also listed below on this slide, they must be stopped a minimum of 3 days prior to your surgery. That would be examples like Jardians. Please know if these medications are not stopped, the SGLT2 inhibitors or the GLP-1 agonist, prior to surgery, that your surgery will be canceled. We're slowly getting closer to the day of surgery. So on the evening before surgery, you'll receive a call from the surgical department in the hospital to confirm the actual time of your arrival to the hospital for your surgery. The phone call is typically between the hours of 12 p.m. and 4 p.m. If you have not received a call by 5 p.m., we ask that you please call 603-308-0060 to confirm your time of arrival. Please do not call before 5 p.m. If your surgery is on a Monday, you will receive a call on Friday, and your time will not change over the weekend. Please remember, there is nothing to eat after midnight the night before your surgery, but you are allowed to consume 16 ounces of clear liquids up to 4 hours prior to your arrival time for surgery. Gentlemen, please do not take medications that treat erectile dysfunction, such as Viagra, the night before surgery. Taking this medication the night before surgery will cause your surgery to be canceled and for it to not move forward and have to be rescheduled. Alice Peck Day is now utilizing what is known as the Corey Surgical System. This is a robotic-assisted system that helps perform total joint replacement surgeries. If this is something that you are interested in and would like to pursue, please make sure that you call the office and we set up an appointment for you to discuss this with your surgeon, as this is the way you want your total joint replacement to be performed. When you are arriving for your surgery the morning of, you will go to the main entrance of the hospital. The hospital is the large brick building on the Alice Peck Day Memorial Hospital campus. Please look for the main entrance sign and enter the hospital and look for the signs that will bring you to the registration desk for check-in. Once you are checked in, please make sure that you go back to the lobby and have a seat and wait for a nurse who will come and get you from the pre-op area to take you back to get you prepared for your surgery. You are allowed to have one person with you as you are preparing for surgery. That person can come and be checked in with you, wait with you in the lobby, and then they will be escorted back with you when you are taken to the area that you will get ready for surgery in. This is called the pre-op area or same-day surgery department. This is the department where you will be prepared for surgery by the nurses working with the anesthesia providers and the surgeons. Same day does not mean that you will be going home that day. That is just where we admit our patients when we are starting the surgical process. When you arrive to the hospital, we ask that you please make sure that you arrive without jewelry, do not have any makeup on, no contact lenses, and no nail polish, including acrylics, gels, or fake nails. We can store any removable dental work or hearing aids and glasses for you. We will transport all of your belongings to the recovery room and then to your hospital room that you will be recovering in. Everything will be taken care of and will be stored safely. You will then be asked to undress and you will be asked to put on the hospital gown and the non-slip socks. At this time, your surgical site will be clipped free of any excess hair that you have been letting grow for 5 days since you have not shaved the surgical side. We will also then perform another antimicrobial scrub of your hip or your knee from your hip to your toes of the surgical side. We will scrub far more larger of an area than we will be performing the surgery in. This is to help reduce any risk of infection. A nurse will then take your vital signs, perform a complete assessment listen to your heart and your lungs, and will start an IV, an intravenous line, which is where you will receive your IV fluid and medications. You will then be given a pen and asked to initial your surgical side, which is where your surgeon will also initial that side to show that you both agree that that is the surgical side that we will be performing surgery on. While the nurses are continuing to get you ready, you are then going to be seeing your anesthesia provider. They will stop by to review your health information and examine you. They're going to go over any information that you gave to the nurse during your pre-admission testing phone call. They're going to explain to you your personalized anesthetic plan and what your options are. Answer any questions you might have about the anesthesia or medications you might receive. They're going to have you sign a consent for your specific anesthesia plan. And please know they're going to manage your medical care during your surgery and are with you for the entirety of the surgery. Different options of anesthesia for a total joint replacement that are offered here at Alice Peck Day Memorial Hospital are as follows. You could have a spinal anesthesia with MAC, MAC, which stands for Monitored Anesthesia Care. Please know that if you do have the spinal, you are awake when the spinal is performed. You do have relaxing medications on board, but you are awake during this, so that way the anesthesia providers can talk to you and make sure you're not feeling anything where you shouldn't be feeling it. The spinal is performed in the operating room with you sitting on the side of the table, of the OR table, and kind of bent over a little bit. The anesthesia providers will then perform this for you, talk you through it. Then once the spinal is performed, they will lay you down, put some medication through your IV, and you will take a nap. You are asleep during the procedure, but you are doing the breathing on your own. The other option is a general anesthesia. General anesthesia is where the breathing is done for you, and there are a lot more medications that are involved. In addition to having either a spinal with MAC or general anesthesia, you also receive IV medications to help you relax and local anesthetics to help the area of the surgery be numb. Why is a spinal a good choice, you ask? Because you have excellent pain relief immediately after surgery. Because you don't have any pain at all. You're completely numb and you feel like a rock star. You have less need for strong pain relieving medications. There's less nausea and vomiting because you don't receive all the medications and gases and such that come with a general anesthesia. You have an earlier return to eating and drinking, and you also have less confusion after surgery. If you have questions about anesthesia and or would like to speak to the anesthesiologist prior to the day of surgery, please make sure that you call the office and ask your nurse to connect you with the anesthesiologist. While we continue to get you ready, after you've seen the anesthesiologist, normally the operating room nurse comes by. They're going to confirm some more information and ask if you have any questions that they can answer. They're going to confirm that we have the right patient and are performing the right surgery. And they are going to seek permission to provide telephone updates to your support person during the surgery, to let them know when surgery has actually begun and when surgery is almost over. You will then also see your surgeon and their PA or physician assistant. They come by to confirm the surgery, review your health information, make sure that we have a signed surgical consent, and then remember that they initial next to your initials, showing that you both agree that that is the surgical side. For those of you that will receive a spinal anesthetic, please note that our surgeons do not put in Foley catheters or catheterize you for surgery. The plan is, once your spinal has worn off, you will ambulate with assistance to the bathroom to see if you are able to void independently. If you are unable to void, a bladder scan will be performed to determine the possibility of urinary retention and how much. If appropriate, a straight catheterization will occur only in the first 24 hours to decrease infection possibility or a bladder stretch injury. Please know that straight catheterization is a quick in and out to get the urine that remains in the bladder out. It is not like a Foley catheter that remains in. If you continue to be unable to void on your own, a Foley catheter may be placed if determined necessary. When normal bladder function is regained, all catheterizations stop. Please know that urinary incontinence is common after surgery and that you should not be alarmed. Once you have seen the anesthesiologist, the operating room nurse, the surgeon, and their PA, only at this time will it be when you receive your first dose of IV sedation. This medication is typically known as Versed or midazolam, and we like to call it liquid courage. This medication does not put you out, but will help to relax you for your trip to the operating room. This medication will be administered. We will say goodbye to your support person, and they will go to the lobby where they will wait for you during your surgery, and then we will transport you to the operating room. Once we are in the operating room, further anesthesia is completed, such as your spinal, if it has been deemed that that is your anesthetic plan. Also, you will then be properly positioned, and another antimicrobial scrub will be performed, as we are now in a sterile environment and are looking to reduce any risk of infection. Please know that performing your spinal, positioning you, performing the scrub, and getting you ready once you are in the operating room can take up to 45 minutes, and that's all before surgery even begins. Then surgery will begin. At this time, the OR nurse will contact your support person via the cell phone number that they gave them and let them know that surgery is beginning, and then we'll call again towards its completion. Once surgery has been completed, you will be transported to what is known as the PACU or post-anesthesia care unit, also called the recovery room. In this environment, when you wake up, you will be fully monitored. You will have an oxygen mask on your face. You will have your IV still in. You will have ice applied to your hip and your knee. There will be a lot going on with a lot of people. Please do not be alarmed, and please ask questions to help reorient yourself as you are coming to after surgery. While you're in the recovery room and waking up, your surgeon will call your support person via the telephone number or meet with them in our family room after the completion of surgery to let them know how everything went and how you are doing. Please know that once you are in the recovery room or the PACU, that you will be in there for approximately 1 to 2 hours. Once that time has passed and you are stable, you will be transferred to your room on the medical surgical unit or the short stay unit, the SSU, if you are going to be going home the same day. Please note that there are a lot of patients who go home the same day as their total joint replacement was performed. If this is something you are interested in, please make sure that you contact the office so that we can let your surgeon know to see if you are a candidate for this. Also, the timing of your surgery plays into whether or not you are able to go home the same day, because if you have a spinal, we need to make sure that that spinal has completely worn off and that you are safe to discharge. Once you are transferred to your room where you will be staying with us, your surgeon, the physician assistants, nurses, therapist, and case management team will all be coming in to monitor you and discuss your progress during rounds, and are all now part of your team. Your care team is composed of registered nurses, RN clinical leaders, licensed nursing assistants. There are so many people that you will meet. Don't worry, there are no tests. You do not have to remember names. But it is important to know that there are a lot of people who play a key role in your recovery once the surgery is complete. Our goals after surgery are to keep you safe, keep you as comfortable as possible, and promote rehab therapies for recovery. Please know that you will not be the only patient with us on the med-surg unit or the short stay unit. These units can tend to be loud, fast-paced, and rather bright. So please consider bringing in headphones and or sleep mask for rest, as rest is going to be of the utmost importance for your recovery. The average length of stay after the total joint replacement surgery is likely to be 1 day. Most of our patients are discharged the day after surgery. However, some patients may go home the same day. If you are interested in going home the same day, please make sure that you have discussed this with your surgeon, as I have stated previously. That way, all parties involved in your care can be prepared for this. It's important to know, especially if you've had a spinal anesthetic after surgery, you're going to wake up not feeling any pain and feeling great. but please make sure that you do not try to get up and do anything on your own too soon. Please use the call button every time you need to use the restroom, you need to move, drop something, notice a spill, or have any questions. We want to make sure that you stay safe and do not do anything that could hurt your surgery. Please never go to the bathroom alone. Do not lean on furniture that has wheels. Make sure you always wear the hospital socks with the grips and safe shoes. Please wear your glasses or hearing aids if you use them when you are awake. And please rise slowly and check for lightheadedness before continuing to get up. It is important to make sure that we minimize any risk of falling for you, as we do not want you to jeopardize the surgery. Please know that physical therapists that are working with you will use a gait belt throughout your stay for safety purposes, and we use them on all patients regardless of their activity level. Please be aware that managing pain is part of the healing and postoperative recovery process. You are having a total joint replacement surgery. Whether it's your hip or your knee, it doesn't matter. It's going to hurt. I need you to be aware that you are going to have pain. It is our job to make sure that we minimize that pain and keep you as comfortable as we can, but it's your job as the patient to realize that there will be pain involved in your recovery. Please know that if you have a spinal, it can take 1.5 to 6 hours or more for feeling or sensation to return to the area of the body that is numb. As anesthesia begins to wear off, you may notice some tingling sensation returning to your toes and then working its way up your legs. Expect to have some pain. The moment that you start to feel any of that tingling or movement returning, ask for pain medication before it becomes too obvious. The sooner you get it on board, the better your recovery will be and the easier it is to stay ahead of the pain. Please know that tingling and numbness around your incision site can occur for up to a year after surgery, and that this is common. Our surgeons like us to reiterate that this is going to hurt and you are going to have pain. It is our job to help you control that pain so that you are able to do the things that the physical therapy is asking you to do in order to recover and heal. Pain management is part of the recovery process. Please note that you will be asked more times than you can count to rate your pain on a scale of 0 to 10 while you are here with us, 0 being no pain, 10 being the worst pain you have ever been in your life. Typically, we try to keep your pain somewhere between a 3 and a 4 to keep you comfortable so you are able to do what it is that you are asked to do. You will be prescribed postoperative medications that will be sent to your pharmacy. They will not be sent to your pharmacy until it is time for you to be discharged from the hospital. The reason being is that the surgeons want to make sure that what we are prescribing you while you are with us is what works, and that you do not have any adverse reactions or are not allergic to any of them. Your prescriptions will need to be filled when you leave the hospital, as that is when they are prescribed. Please call the orthopedic clinic for any pain medication refills. Your nurses are in charge of getting those for you, and you can do this by calling us or sending us a MyDH request through the patient portal letting us know you're getting low. Please contact us before your medication runs low, and absolutely call us before you run out of the medication. We need time to prepare this medication and get it to the pharmacy to make sure it can be filled. And you need to make sure that you are continuously taking the medication. You never want to get to a point where you are out of medication, because then you fall behind the pain and it is not easy to catch back up and get ahead of the pain. The more that you can take the medication, keep yourself comfortable, and be able to perform your rehab activities, that's going to help you in your recovery process. Please know that most of our patients will have on a water-resistant bandage that will be placed over your incision. The bandage is on for 5 days, and then it will need to be changed on day 5 and then left on for an additional 5 days and removed on day 10. On day 10, you may remove the bandage and leave your incision open to air so that it is able to dry. Please note that if you are a Dr. Tomek patient, you will have a clear mesh material that will stay on for 4 weeks after surgery that will be under the water-resistant bandage. So you remove the water-resistant bandage but leave on the mesh. When the mesh material starts to peel, you may trim the edges but leave on the pieces that are still down. Make sure you are discharged home from the hospital with a bandage to perform your bandage change at home on day 5. You may use a compression sleeve if needed to help with swelling. And if you have questions about your bandage change while you're performing it at home on your own, please call our office and our nurses would be happy to walk you through it. It is important for every patient to know that we have an after-hours on-call service through our orthopedic clinic here at Alice Peck Day Memorial Hospital. That number is 603-308-0044. Please know there is always an APD orthopedic provider from our practice that is on call and available. Please make sure that if it is after hours or on the weekend that you call the number above and not your nurse's direct line. If you call the above number, you will be sure to get a call back. A lot of our patients have questions regarding traveling after surgery. Is it okay to go on long car rides or flights? You may go for a ride after surgery if you are feeling up to it as a passenger. Please know that air travel will be at the discretion of your surgeon due to the high risk of blood clots in the postoperative period. If you do go for a car ride, you should plan to stand, stretch, and walk around the car at least every 1.5 to 2 hours. You don't want to be in the same place or position for too long. This will help to improve blood flow from your lower extremities and to help prevent you from getting a blood clot if you can get out and move around during your travels. Please remember there is no driving for at least 1 month after surgery, so please plan accordingly. You will be cleared to drive if you are able to do so once you come in for your 1-month postoperative appointment. Things that you do not want to be dealing with while you are trying to recover from surgery are constipation, sleeplessness, and muscle spasms. To help prevent constipation, we ask that you get the following over-the-counter medications and use them together. Colace, 100 milligrams. You're going to take 1 tablet twice a day. And you're going to also use Miralax, which is a powder. You're going to use 17 grams, which is a capful. And you're going to use that once daily mixed into a drink of your choice. Use these medications together to help keep you going and keep you regular. Your narcotic medication can be constipating, so while you are taking your pain medications, please make sure that you are taking the Colace and the Miralax. If you develop any sleeplessness, we ask that you please contact your primary care physician if you feel that you may need some sort of a sleeping aid. And if and when you develop muscle spasms, which show a sign of healing and progress with your recovery, please make sure that you contact us in the office as we will help discuss with your surgeon which muscle relaxant that we should prescribe for you. Disability and FMLA. If you are employed and working, please contact your Human Resources Department and request any paperwork that they need us to complete for you. Please drop the paperwork off at our office. We will complete it and return it to you so you can get it back to your employer. If you have any questions about your paperwork at any time, please call 603-308-0433, as this information is filled out by a team of our providers in the office, and anybody can help to answer your questions at this number. This will help to ensure that you receive a paycheck and have documentation from your surgeon for being out of work. It's important to get this information completed and get it filled out in a timely manner. Doing this early in the process will help expedite timely disability payments and reduce stress.
The purpose of a total joint replacement is to remove the damaged bone of that joint, replace it with a smooth artificial implant known as a prosthesis. This prevents the bones from rubbing together and provides a smooth joint. Your physical therapist will focus on strengthening your muscles so you can resume to standing, walking, reaching, or other activities that you want to return to. Your PT may focus on these areas, which are strength, balance, range of motion, pain, swelling, and scar management. Your physical therapist will make sure that you feel safe using your walker so you're able to walk and climb the stairs in your home, and make sure that you feel comfortable with your weight-bearing status, and provide you with a home exercise program. It is important to note that after a total hip replacement, you do not do any formal physical therapy for 4 to 6 weeks. Your goal should be to be active for 15 to 20 minutes every hour while awake. You're also able to perform ankle pumps and ankle circles in order to reduce any edema. A basic home exercise program will be reviewed with you prior to your discharge. Your physical therapist will make sure that you are independent with your bed mobility, independent with transfers, independent with home access, independent with your home exercise program, and be able to have safe mobility with assistance of a caregiver as needed. Some pain is expected following surgery. Stay on schedule with your pain medication, stay ahead of your pain, and remember, RICE, rest, ice, compression, elevation. You may shower 48 hours after your surgery with a water-resistant bandage in place. No swimming or no soaking in a tub until after your follow-up visit with Orthopedics. Here are your lifting guidelines. For the first month, no greater than 10 pounds. Second month, no greater than 20 pounds. And the third month, no greater than 30 pounds. We suggest that you do 15 to 20 minutes of activity, including exercises, and 40 to 45 minutes of rest with your feet elevated above your heart. Any additional guidelines will be given to you by your surgeon and the orthopedic physician's assistant. The occupational therapist will help you with independence to improve your ability to perform activities of daily living. This will include dressing, grooming, bathing, toileting tasks, general recovery, functional mobility, and discharge planning. The occupational therapist will provide you with a long shoehorn, a sock aid, a long-handled sponge, elastic laces, and a dressing stick, as well as a front wheel walker with a basket, as well as a commode, handheld shower, tub or shower chair so you are safe to reduce any chance of falls. If your insurance does not provide you with adaptive equipment, you can ask your family members. You can also check out the local VA, senior center, or the Lions Club. Prior to surgery, remove all throw rugs and other trip hazards. Have pre-cooked meals, easy to prepare, or frozen meals ready. Place items that you often use where you can reach them. Avoid the crisper and drawers so you do not bend. Consider making a pet care assistance plan. Please make sure that you have a well-lit pathway from your sleeping area to the bathroom to prevent falls. The day of your surgery, remember to bring your walker, adaptive equipment you have obtained. We will practice how to use it with you and provide suggestions. Remember to bring loose-fitting, comfortable clothes and supportive shoes. And don't forget to bring your home exercise program. We'll be happy to review it with you.
As we review our presentation today, there are things that I want you to remember. You are not to get any vaccines 2 weeks prior to surgery. Do not apply any deodorants, creams, lotions, or oils the night before surgery. Do not take Viagra the night before surgery. Please remove all nail polish and jewelry. No food after midnight, and no drinking of clear liquids 4 hours prior to your arrival time. And there is no swimming, soaking, no pools, no bathtubs, no hot tubs, or driving for 4 weeks after surgery. And if you are interested in taking a trip on a plane, you need to speak with your surgeon about the timing of doing so after surgery. Please remember that you'll need to pick up your nasal antibiotic known as mupirocin from your pharmacy. You will also need to get the Hibiclens from our office or your pharmacy. Remember to bring earbuds, headphones, a face mask, any durable medical equipment, your walker, your CPAP and BiPAP and inhalers, and supportive shoes. Please remember to call, don't fall, always ask for help while you are here in the hospital. There's always somebody who will be at your door as soon as you hit that call button. If you have any questions or concerns or are looking for up-to-date information, please visit our website at www.alicepeckday.org. If you have any questions following the online video presentation, please contact the appropriate nurse for your surgeon. Our nursing contacts are as follows. For Dr. Hood patients, we ask that you please call the nurse at 603-308-0449. And for Dr. Lin and Dr. Tomek patients, please call the nurse at 603-308-0425. I would like to thank you for spending your time watching this presentation. I wish you the best of luck with your surgery, and we will see you at APD.